Dr. Rocco, anything you want to add?
Well, I think people who have a tendency towards depression often suffer from what's called a tyranny of the shoulds. And during the holiday season, there are lots of shoulds out there, including the one that no matter what's going on with you, you're supposed to be happy during this time. It should be cheerful and so on. And if you're finding yourself feeling sad, the expectation to be happy can be really difficult.
There's a good friend of mine said you should make sure that you don't should all over yourself.
Right.
That was a perfect comment. I want to go back a minute because one of the other things I noticed that happens is someone has lost a loved one, right. A brother, a sister, mother, father, what have you. And this is, as you were talking a few minutes ago, this is the first season of holidays that they're celebrating without that individual. Right. And they fall into a sadness and don't really know why. Would you say something about that?
Sure, absolutely. That loss that they're experiencing is definitely going to have an effect on their holiday. And again, I think that should comes into play here also, that I should put that aside for now because it's the holiday season. I need to take care of other people. But what they can sometimes do to help with that is it can be difficult to repeat the same family traditions that you have done in years past when that loved one, that special person was a part of it. That can feel very empty. So sometimes creating a new tradition, something a little bit different this year, can go a long way toward helping that with folks. And also being willing to talk about it, being willing to be honest with people around you. You might not feel like going to that party. You might not feel like participating in these events. And it's okay to tell people that and to just be honest about those feelings.
And you give yourself permission to recognize, I just don't want to do this. And let
and that's
people know
okay.
It's okay.
Exactly.
Okay.
Exactly.
Ed, could you say something about services available at 7 counties?
Sure. A portal of entry in terms of looking at being able to obtain information about what may be going on with you or what kind of services could best serve the needs that you have would be the Crisis and Information Center. And that's available 24 hours a day, 7 days a week. And that would be the first thing that I would recommend people interact with. There would be an assessment to determine what kind of needs are being seen and whether we just give some tips about how to deal with what's going on with you, or whether there's something more significant, and that would take a referral to a particular service.
And when people call the crisis center, it can either be the person who's experiencing the depressive feelings themselves, or a family member or a friend who's concerned about someone that they think might be having some difficulties. And what will happen when they contact the center is a trained counselor will immediately be able to provide to them some counseling just to listen to what's going on without judgment to them. They'll be able to help with some kind of advisement as to what type of resources or referrals might be best to help with the needs. And the center has a computerized database with literally several thousand entries in there of local resources and information that we can provide to people that might be able to help them in a more ongoing way. And if we feel that the person calling or the family member or friend could benefit from counseling on a more regular basis, then we work with our Access Center and can make a referral for more ongoing services.
Well, I think the only thing I want to make sure I mention to those who are listening is, this whole question of mental health and mental illness and quote-unquote stigmas associated with this. It's okay to feel sad. It's okay to feel what you feel. It's okay to call a service like 7 counties and say, I've got some issues I want to talk to you about, and not worry about the stigma. It's time we got well past that. Here's a great service for you. It's available, and Dr. Bracco and Ms. Robinson are saying, call us if you have an issue.
Yes.
We'll be glad to help you out.
Absolutely.
Beyond that, just enjoy yourself and do what you need to do to feel good about the holidays. I want to thank our guest, Dr. Bracco and Ms. Robinson, for being here today. And we'll be right back.